Hi, my name is David Amazon, and I'm a student physical therapy assistant from CBD College, and today we'll be going over blood pressure. What is blood pressure? Blood pressure is the force of your circulating blood pushing against the walls of your arteries. It's measured with two numbers. First one is systolic, and it is the pressure of when your heart beats and pumps blood. The second number is diastolic, and it is the pressure of when your heart rests between beats. It's written in systolic over diastolic, and normal levels are 120 over 80 millimeters of mercury. What is needed to take blood pressure? When taking blood pressure, you need a blood pressure cuff as well as a stethoscope when it's being taken manually. There are those levels that are considered out of the norm, and they can either be below normal, which is known as hypotensive, or they can be above normal, which is known as hypertensive. Hypotension is known as low blood pressure, and it is classified as 90 over 60 millimeters of mercury or less. Some symptoms of hypotension can be dizzy, lightheadedness, blurry vision, and fainting. Causes of hypotension can be dehydration, any types of medications, or underlying medical conditions. Some treatments in regards to hypotension can be an increase in fluid intake, that specifically being water, an increase in salt intake that helps by retaining more water in the body, as well as medication adjustments. Some symptoms of hypertension can be severe headaches, frequent nosebleeds, chest pains, shortness of breath. More often than not, these symptoms don't come until hypertension is very severe, so it is important to have your blood pressure checked out more often than not. There are two types of hypertension. Those can be primary and secondary hypertension. In primary hypertension, it has no identifiable cause, as well as it being the most common type, and it is linked to genetics, obesity, high salt diets, as well as lack of exercise. In secondary hypertension, it's caused by underlying medical conditions, medications, and even kidney disease, thyroid disorders, as well as certain medications. In regards to treatment for hypertension, we can implement lifestyle changes. That means an increase in exercise from day to day, as well as healthier food habits. There can also be some medications that can help with hypertension, such as diuretics and ACE inhibitors. Hypertension is generally classified into three stages, with normal and elevated levels, going into stage 1, stage 2, and then a hypertensive crisis. In elevated blood pressure, the systolic begins to stay within the ranges of 120 to 129, and diastolic tends to be at 80 or less. In stage 1 hypertension, systolic is at 130 to 139 millimeters of mercury, and diastolic is around 80 to 89 millimeters of mercury. In stage 2 hypertension, systolic is 140 millimeters of mercury or higher, and diastolic is 90 millimeters of mercury or higher. The last one, a hypertensive crisis, is where our systolic is higher than 180 millimeters of mercury, and diastolic is higher than 120 millimeters of mercury. This one, by the way, requires immediate medical attention. Thank you.